So today's ICA for coding is this one right here under session 12 called Skin and Tissue Abstracting. So when you click on this, and yours is going to look a little different than mine, that's fine. But I just want to point out here that you do have 2 attempts to get a higher grade. So if you don't like your grade the first time, do it again. If you like your first grade, then you can accept it and be done. So it will not show you the correct answers, and I'm not even sure it'll show you your answers. It will tell you which ones you got wrong, though. So you might want to do it on paper as well as put it in the computer, so that way you don't have to redo the ones you got right. It's a little trick. But I want to talk about this assignment and some of the things that might help you be successful in this assignment. Some of this that we're about to talk about is for all body systems, not just this ICA. It's all coding completely. So before you get going, get your ICD book out. I know it's really big and really heavy, but it has all the codes that you need in here. And if you turn into a coder like I am, you will love your book. So when you read a patient's chart note, the first thing you're going to look for is the chief complaint. This is what the patient's complaining of. So the medical assistant walks into the room and says to you, "So what are we seeing you for today?" This is typically the words that come out of your mouth. Patients don't typically know what's wrong with them. They only know what they're feeling or seeing. So I might not know what this rash is, but I know there's a rash here that doesn't belong, and I know it's itchy. I may not know what's wrong with my belly, but I know that it hurts. So typically the patient is giving us symptoms. The doctor will take what the patient says as symptoms, put it together with their physical exam, maybe some tests, and then the doctor will say, it is this. Give us a diagnosis. And that's the diagnosis. It's a definitive diagnosis from the doctor. Sometimes the doctor will also document what caused the condition, but not always. But the example I'm about to give you does have a cause on it, so I wanted to put that on this slide because we're going to see that on the very next slide. So the patient comes in and says, "I was hiking and I have these red patches on my skin that itch." After an exam, the doctor says you have contact dermatitis, which means inflammation of the skin from touching something, and it's due to poison ivy. Now, that patient might go home and say to their family, "I have poison ivy," but technically they have contact dermatitis caused by the poison ivy. So the chief complaint is what the patient said. So that would be the red itchy patches. I heard you say it. So the question is, do we code the red itchy patches? I can find a code for a rash. I can look that up. I'll find a code for it. The question is, do I need to? And as students become more experienced, they know the answer to this. No, we do not code symptoms when we know what caused it. So do we know the cause of those red itchy patches? Yes, we know it's contact dermatitis and it's poison ivy. So when we know the cause, we do not code the symptoms. For example, if you have the flu and you go to the doctor, you're going to complain of fever, chills, my body aches, I'm tired, I'm exhausted, maybe even headache, nausea, all of it's the flu. We would code the flu. We would not code all these things you're complaining of because it's part of the flu. But if the patient complains of something that is not part of the disease, you would code it separately because the disease doesn't explain it. For example, you sprain your ankle. It's painful, you can't walk, it's all swollen. Okay, that's all sprained ankle. But you're also complaining of a headache. Headache isn't part of a sprained ankle. So we would code the symptom headache because it's not part of the sprained ankle and we don't know the cause of the headache. Okay? So you can't just disregard all symptoms. This is why knowing what the disease is all about is important for us coders. Why we learn anatomy. One reason we learn it. So we know the chief complaint, but we're going to not code that. We know the diagnosis, and we know the cause of what caused that dermatitis. Okay, so to code that, you go to your code book, and you go to the alphabetical section, and you look up the word dermatitis. You always look up the main word of what is wrong with the patient. Contact is an adjective describing the dermatitis. Dermatitis, and then when we get to dermatitis, we come down to contact, because that is what kind of dermatitis. You look at all, there's dozens kinds of dermatitis here. We're going to go down to contact. So if you have not gotten to this part in your code book, pause the video and restart when you get to this page. It's very important that you are following along with me, not just watching me. That doesn't help you do your assignment when you're done with this video. And this is a very short video. So if you're doing the assignment in like 15 minutes, don't neglect to code along with me. Okay, so you come down here to contact. Doctor didn't say it was allergic, so I'm not going to use this entry. I'm going to come down to this entry. And I look at all the different kinds of due to. I don't see poison ivy. Now what do I do? So poison ivy isn't listed, so look at what your options are. Your options are a whole bunch of things, but one of them is an option for a plant that isn't food. Well, that's poison ivy, right? We don't eat poison ivy. So a plant non-food is poison ivy. Now, other plants will fall into that. You probably heard of like poison oak. That would fall into the same code. But all the non-plant foods or non-food plants fall into the same code. They don't have a code just for poison ivy. And so my index says L255 is the answer. Do not go with that without confirming, ever. Okay? Could you? Yes. Might you get it right? Yes. You'll get about an 85% if you code from the alphabetical index, and that may be good enough for you. Not good enough for you in a job. So don't start your lazy habits now. That's what I always say. So it's recommending L255. So now, in your code book, go to the code section for the L's and find L255. Again, pause the video till you get there and then restart it. When we get there, this is what we see. Unspecified contact dermatitis due to a plant except for food. We still are good. Always read your excludes notes. Excludes one means you're in the wrong place. So if this was a plant from a nettle, which is a specific plant, you're in the wrong place. They have a special code just for nettles. Also, if this was an allergy, we're in the wrong place. A pollen allergy doesn't count here. They have a special code because you're allergic to pollen. Now, none of those things were said in this question, so we can read and discard. I always say consider if they apply. Those excludes do not always apply to the question you're doing, but you always have to read them and consider them. So I considered the nettle and I rejected it. I considered the allergy due to pollen and I rejected it. So that means I like the code that we found, and L255 would be the correct answer. You will see the term laterality in coding. You'll see it in today's assignment. You'll see it all over the place in every mod. Laterality is referring to the side of the body. The left side or the right side? You got two hands. So if you do let's say this contact dermatitis was on my hand, which one? Okay. Sometimes the answer means bilateral, which means it's on both. Okay. So if I tell you that this rash is on both sides, and then I ask you the laterality, your answer is left and right, or bilateral, depending on what your options are if it's a multiple choice question. Unilateral means one side. So if the doctor says it's unilaterally on the right, and then I ask you what is the laterality, the right side, or one side of the body, depending on what the question really says. Sometimes your doctor doesn't specify. And so your laterality would be unknown. This concept, these terms, only apply to body parts you have two of. So if the doctor documents that I have a lesion on the left side of my nose, well, I only have one nose. So while it's on the left side of my nose, it is not on my left nose. So you may get into coding that lesion, and you may go, wait a second, it's the left. Why isn't there a code for the left? Because it's doctor said left. Why don't they give me that choice? Because I don't have two noses, that's why. So the fact that the doctor documented the left side of my nose is great documentation by the doctor, but it's not a piece we need when we're picking our codes. However, if we have two body parts, it's our hands, we definitely need a left or a right choice. Okay, the other concepts you're going to see regularly is, so you're going to hear the abbreviations or see the abbreviations NOS and NEC. NOS means not otherwise specified, and NEC means not elsewhere classified. A lot of students think that these two things mean the same thing, and they do not. So this is how I like to explain it in the classroom. I hand out a questionnaire and ask you for your favorite color. And when you turn it in, my tally that I'm going to keep track of your answers are red, blue, green, other. So I look at the first person's answer, and they told me blue. So I'm going to put a little tick mark here that somebody said blue. Then I look at the next one, and they said green. Great. I look at the next one, and this person said purple. Well, I only have red, blue, and green as my options. So purple is other. The next person answers none of your business. So they didn't give me a favorite color. So their favorite color is unspecified. Okay? So unspecified is not specified. NOS, not otherwise specified. But other is NEC, not elsewhere classified. So not elsewhere classified means we know what their favorite color is, but it's not one of the choices I have on my list. Okay, does that make sense? Hopefully. Still with me? Okay. So now I'm going to move into healthcare. B95, which is a section you'll need in today's ICA, is for streptococcus and staphylococcus as the cause of a disease elsewhere. So the patient has some other disease and the doctor says the infection is staph or strep. You're going to need to come here and use a code from this B95 section to code what kind of staph or strep the patient has. So let's take strep and then we'll talk staph. So here's my choices for strep. Strep group A, strep group B, strep pneumoniae, however you pronounce that, other strep, unspecified strep. So we have A, B, and strep pneumo as like your favorite colors, red, blue, green. Then we have other for that purple person who said purple was their favorite color. And then we have the unspecified for the person who said none of your business. So if the doctor did not tell us what kind of strep this patient has, we have to go with this unspecified. Because doctor didn't tell us. It could be A, B, or pneumo, and the doctor just didn't write it down. So we're going to go with unspecified strep. But if the doctor told you what kind of strep it was, and it wasn't A, B, or pneumo, but it was yet another kind. Let's say there's a type C. I don't know if there is. I might be making it up. But let's say there's a type C, and you go, I have A, B, pneumo. Where's my C? Not there. Guess what? You would go with other. You would go with this other strep because you know what kind it is, and it wasn't an option you were given. It's just like the person whose favorite color was purple. Okay, so those are your strep codes. Staph, we have Staphylococcus aureus, other staph, or unspecified staph. For Staphylococcus aureus, we have methicillin susceptible and methicillin resistant. So we have two kinds of your Staphylococcus aureus. So you may have heard more commonly the methicillin resistant staph. That's called MRSA. That means that an antibiotic can't kill it. That's a very serious condition. And then methicillin susceptible means an antibiotic can kill it. So that's called MSSA, for methicillin susceptible. Okay, so that's assuming you know what kind the patient has. Now, of course, we have other staph and we have unspecified staph that works exactly like the strep I was just explaining. I don't need to say it twice. Okay, so all of what I just talked about is going to help you on today's ICA. So refer back to this video if you need to, if you get stuck on that ICA, and you should do very well given this information. So good luck.